Hello, everyone. I'm Yutao Guo for Chinese PLA General Hospital, Beijing, China. Also, I'm very honored to be a visiting researcher for Liverpool Center for Cardiovascular Science. It's my distinct pleasure to introduce our work, which cooperated with Prof. Lip for LCCS. Smart technology facilitated early diagnosis and integrated care of atrial fibrillation, the MAFA program. I have no disclosure. Why we do this? Atrial fibrillation detection is problematic as often asymptomatic. The first complication often with the first presentation often with a complication such as stroke. There was about 10% to 30% patients were diagnosed with atrial fibrillation after they suffered stroke. Moreover, the first medical provider atrial fibrillation patient contacted might not only cardiologist, but also general practitioner, pharmacist, neurologist, nurse, etc. So an integrated care approach is needed to provide a streamlined clinical pathway management for atrial fibrillation. How do we do this? MAFA2 program is designed to investigate mobile health technology for improved screening and optimizing integrated care approach in atrial fibrillation, which including the pre-MAFA phase of atrial fibrillation screening. We also called Huawei Heart Study using Huawei smart device. This phase investigated the incidence of identified atrial fibrillation with PPG-based screening approach in general population and comorbidity. The identified atrial fibrillation were considered for entry into the MAFA2 clustered randomized trial, which validated an integrated care pathway ABC supported by mobile health technology in the management of atrial fibrillation. Pathway A, avoid stroke with anticoagulation. Pathway B, better symptom management with patient-centered, symptom-directed shared decision for rate or rhythm control. Pathway C, cardiovascular risk and comorbidity management. Last year, we reported Huawei Heart Study in ESC Congress. Among more than 180,000 subjects, there was 0.2% subjects received the notification of suspected atrial fibrillation, and 87% had atrial fibrillation confirmed by doctors. Among them, about 95% entered the MAFA integrated care program based on the ABC. Then we reported the short-term outcome of MAFA2 clustered clinical randomized trial. Compared to the patients individually randomized into usual care, the patients using MAFA had significantly reduced the risk for primary endpoint, which was the composite endpoint of ischemic stroke, systemic thromboembolism, all-cause death, and rehospitalization. This year, in the 2020 ESA Congress, we reported the updated data. MAFA2 program is ongoing program. Now, there was more than 1 million subjects involved in atrial fibrillation screening phase, and about 0.29% received the notification of suspected atrial fibrillation. About 60% subjects were effectively followed up by MAFA TTKR team. And among them, 94% subjects were confirmed with the diagnosis of atrial fibrillation with clinical review and ECG by MAFA Network Hospital. This slide showed the 94% subjects were confirmed with atrial fibrillation. And we developed artificial intelligence machine learning atrial fibrillation risk prediction model. And this model could predict the risk for atrial fibrillation onset 4 to 8 hours in advance. How MAFA provides the pathway A avoid stroke with anticoagulation. This slide showed how the MAFA do this. MAFA provides the clinical decision supporting tool, including chest-wise score to assess the stroke risk, heart split score to assess the bleeding risk, and the same TTR score to assess the anticoagulant quality of warfarin. And the MAFA can automatically monitoring dynamic bleeding risk together with TTR, liver, and renal function. Then the adjustment of anticoagulants dosage based on TTR, liver, and renal function were proposed, complied with the guidelines. This showed how the MAFA provides the pathway B better symptom management. The left showed a male patient, 58 years, with paroxysmal atrial fibrillation. When the patients had the compatible smart device, we could monitoring their pulse rhythm. The red indicated the suspected atrial fibrillation. Purple demonstrated the premature, and green indicated the normal rhythm. So the MAFA doctors could regulate the read or rhythm drugs based on the rhythm monitoring. The right showed another patient, male, 37 years, paroxysmal atrial fibrillation. I feel it. It's like the piano key of the knife. Showed when he received atrial fibrillation ablation. After that, we monitoring their heart rhythm. Recovered to the rhythm, normal rhythm. So it's like the piano king of the knife, his rhythm monitoring. This slide showed how the MAFA provides the pathway C cardiovascular comorbidities message. This is a very old patient, 80 years old, with persistent atrial fibrillation. We can see he suffered hypertension, heart failure, and coronal arterial diseases. And MAFA could follow up. There's a blood pressure. This showed the changes on blood pressure, and he could reported the symptoms related to ACS, angina, or heart failure, and the MAFA doctors could regulate the therapy for him based on this monitoring. Besides, MAFA also provide the educational interactive program. This shows the educational video the patients could link the video to watch this educational material. This showed the articles, and there also is question and answer. We selected the patients' questions and the answers for pushed for other more patients. And this is a program we called "What Trigger Your Atrial Fibrillation" to help patients to look for the trigger risk for atrial fibrillation. During the coronavirus 19 outbreak, to reduce the risk for the coronavirus 19 infection, we initiate the telemedicine and the cloud-based health classroom. This is me, and this is another doctor. We gave the we talked with the patients on the MAFA Pro platform. So, ladies and gentlemen, in conclusion, the MAFA program links atrial fibrillation screening with eligible patients who were subsequently entered into a structured care pathway with mobile health technologies. This highlights the potential application of mobile health management for atrial fibrillation, urgent primary care, and secondary care management. Thank you.